This is the case of medial femoral condyle osteochondral defect. As you can see, it is a large osteochondral defect on the weight bearing area of the medial femoral condyle. The defect area is prepared, all the fibrous tissue is removed, uh, and the size of the defect is measured. So it is the size of 8 millimeter temp. So as you can see, 8 millimeter superiorly and 8 millimeter inferiorly, around 2 osteochondral cylindrical plugs will be required. So a non-articulating and non-weight bearing area of medial femoral condyle medial to the trochlea is identified, and just medial to the patella accessory medial portal is placed, and the donor cylinder of the Arthrex OATS system is used. Middle side of the trochlea and the depth of around 15 millimeter is obtained. Now the recipient site is being prepared. If the length of the osteochondral donor graft is 15 millimeter, then the recipient site is prepared up to the depth of 13 or 14 millimeter. It is not prepared up to 15 millimeter, otherwise the graft can get sunk deeper from the level of the cartilage. So as you can see in this, we are preparing the recipient site up to 13 or 14 millimeter. Last 1 or 2 millimeter of compression is made through last degree of hammering over the osteochondral graft. Now the donor site osteochondral graft delivery system is inserted into the defect created at the recipient site, and the graft is being pushed inside with the rotatory system given at the Arthrex OATS attachment site, and the cylindrical graft is slowly gradually going in the defect. Now as you can see, the some part of the cartilage is projecting outside. The last 1 or 2 millimeter of the compression is obtained through the temp and by gentle hammering all around, so that the cartilage becomes flush through the parent cartilage and you get the good press fit compression. Now the same step is repeated for the inferior defect, and another 8 millimeter of the graft will be obtained from the donor side of the non-articulating and the non-weight bearing area of the trochlea. The bone which is obtained from the recipient area is inserted into the donor area, so that the defect is filled with the bone and you will get a fibrocartilage over a period of time. Now another osteochondral graft is obtained by following the similar steps, and it is inserted inferiorly. Make sure that there is around 1 millimeter of bony breach between the two plugs to avoid unnecessary complications of convergence of both the cylindrical defect. To get the proper hold of 360-degree around the that osteochondral cylindrical graft, make sure that both the plugs are flushed to the surrounding system. The defect in between which you are seeing will eventually be filled with the fibrocartilage. You can do the microfracture also. By doing flexion and extension, make sure that any portion of the graft is not projecting to outside the joint, to avoid clicking noise post-operatively and to avoid friction between the two cartilage surface. And similarly, the bone obtained from the recipient area is again inserted into the donor defect, so that that fibrocartilage will be formed.